A study showed that between a quarter to a half of people who arrive at hospital for chest pain not related to a heart attack are actually suffering with heart anxiety, sometimes called cardiophobia. Studies have also shown that people with cardiophobia worry more about their hearts than people actually diagnosed with heart disease. Tests on people with cardiophobia find that they are even more tuned into any sensations in their chest than people who really do have heart disease. So why are so many people worried about their heart? And if there's nothing wrong with their heart, why are they getting symptoms that feel like something is wrong? This video explains why you get these symptoms and also how cardiophobia is best treated. So make sure you stay tuned to the end. Firstly, a lot of anxiety symptoms are similar to heart attack symptoms. When someone is anxious, the body releases adrenaline, raising their heart rate. Breathing can become fast and difficult. A rise in temperature causes sweating, and blood flow is reduced to the ears, which can cause dizziness. Changes in blood flow can also cause numbness or tingling at the extremities. Muscles can tense so much that it causes muscle pain, and if this pain is in the chest or arm, again it can be mistaken for a heart attack. In addition to these temporary symptoms, anxiety can cause more long-term symptoms, like GERD, IBS, or ectopic heartbeats, all of which can feel like a serious heart problem. By the way, there's a link to my video on IBS and anxiety at the top, and I'll put a link to my video on ectopic heartbeats at the end of this video. Studies on people with heart anxiety often use cardiac anxiety questionnaires, and these reveal some common factors in people with cardiophobia. They have cardioprotective behaviours, like avoiding any physical exertion, constantly checking their pulse, repeated checkups at doctors or hospitals, and seeking reassurance from others. They're also more prone to catastrophic thinking than even patients with heart disease, and are more prone to making incorrect judgments about what their symptoms mean. Numerous studies show that cognitive behavioural therapy is the best way to treat cardiophobia, and this is no surprise, as cognitive behavioural therapy deals with changing thoughts and behaviours to interrupt the anxiety cycle. The anxiety cycle starts with a thought, like maybe there is something wrong with my heart. This causes feelings of anxiety, which leads to physical symptoms, like an increased heart rate or muscle tension. This leads to reassurance-seeking behaviours, and people with heart anxiety often have multiple gadgets, like blood pressure monitors, blood oxygen meters, and heart rate watches. But instead of reassuring you, you start questioning the readings, which just reinforces the thought that there is something wrong with the heart again. So the thought gets stronger, causing more symptoms, leading you to do more reassurance seeking, like posting your blood pressure reading on social media to get reassurance from others. And so the anxiety cycle goes around and around. The thoughts get more catastrophic, the symptoms get worse, and before you know it, you're back in the emergency room at the hospital. If any of this sounds familiar, let me know in the comments below. CBT gives you tools to challenge your thoughts and change your behaviours in order to bring the anxiety back under control. The best way to get CBT is through a therapist, but as some people cannot access or afford a therapist, my channel has many videos teaching you how CBT tools can help a whole range of anxiety disorders. So make sure you like and subscribe. And if there is enough interest, I will do another video specifically looking at how to use CBT tools for cardiophobia.